You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers! Today I'm super excited to have Tanya Grantham back on the show. She is one of the leading vets here doing rehab in South Africa. She has a practice called Animal Health and Hydro, and it's based in Benoni. Tanya, thank you so much for joining me.
Hi Megan, thanks for the invitation.
Tanya, today we're going to be chatting about your experience in treating juvenile cases. And I think this is such an interesting topic because it's one of those kind of cases, if we can see them early enough, we can really make a difference. But often we don't, do we? We don't see them early enough.
Yeah, and I think that's prompted the discussion. I would really, honestly love to see more juveniles. I'm not sure that there's enough awareness in the general population, even with vets, with dog trainers, with the people that are actually working with the puppies. I don't know if there's enough awareness to be saying we need to be getting the diagnosis sooner rather than later, because then we have a better chance of positively influencing the outcome.
What are the conditions that you're seeing the most in your clinic?
The most common juvenile condition I see is hip dysplasia. At least that is something we seem to be able to diagnose fairly soon. I mean, I think the youngest puppy I had was 5 months. I've got another one that should be coming in. I think it's about going on 4.5 months, giant breed. I do see a couple of early elbow dysplasias. Most of them go for surgery. I think the OCDs, the osteochondritis dissecans cases are being diagnosed. I would like to see more of them following on the diagnosis and whatever is being done by our colleagues. Angular limb deformity, often we see. I think even medial patellar luxations, they are juvenile conditions, and that's a very controversial topic. Should we, shouldn't we? But I do think that the rehab community can and does make a difference depending on the grade.
Yeah, I mean, if you look at all of those conditions, some of them are easier for pet owners to pick up, right?
Yes.
So like the hip dysplasia, they start to notice the dog can't jump onto things, or maybe they're bunny hopping. The medial patellar luxation, if it's advanced enough, they might see them kicking, or they might see that their leg conformation doesn't look right. But some of them, for example, like the elbow dysplasia, sometimes those present on and off. The OCD lesion, they're lame and then they're not. And so the owner maybe thinks, the dog's just hurt itself. Maybe he slipped off the couch or something like that. And, it's on and off. So these cases, the owners aren't picking them up, and maybe they're not taking them to the vets. But how can we get the vets to be sending us these cases earlier? Because I think this is the challenge. Sometimes they're diagnosed with these conditions, and then the vet, would say, well, let's just see how it goes. Let's treat them and see how they respond to the anti-inflammatories. And then their next step is to consider surgery if it's indicated.
Yeah, I think the dilemma for the vets is how much money do we spend, and do we actually are we not just being alarmist? If we say, we got to do x-rays, got to take radiographs, we've got to do a full-on examination, and all of those things and the cost that comes with that, I think makes it difficult in private practice to be selling that kind of diagnostic package in order for the decisions to be made. The flip side of that is I remember when I graduated from varsity, and that was a long time ago, there's this thought that is out there with hip dysplasia, for example, that hip dysplasia can only be diagnosed at 12 months. That is not true. We cannot exclude hip dysplasia from a diagnosis until the dog is 12 months or older. We cannot exclude it, but we certainly can pick up hip laxities and malformed joints in very, very young puppies. So for me, it requires a change in mindset. instead of going, oh well, it's a puppy and it's limping and it's on and off and let's just see what happens, we should be having a conversation with our clients to be telling them these are the things that could happen. It could be A, B, C, or D. I need to run a certain number of tests in order to make a correct diagnosis, and then we can choose options with regards to the treatment. And once we know what it is, physiotherapy or physical rehabilitation can become one of those options. Whereas now we're waiting to see if it's something like elbow dysplasia, we're ending up with a diagnosis quite late in the growth phase of the dog, which often leaves us only with the option of removing a fragmented medial conoid process or an united anconial process. If we had done the diagnostics at 5 months of age, we would have the option to place a screw in the anconial process to see if we could get it to fuse, because removing it creates huge instability in that elbow. We could also have the possibility of doing an osteotomy. So it's not only from a rehab perspective that I think we need to be making the diagnoses earlier. I think we should be making it earlier as a profession, number one. Number two, the second thing is that vets listen to research. And unfortunately, I've looked for it. We don't really have research in terms of how does physical therapy positively influence the juvenile, in terms of the juvenile that has a problem. So, but if we look at the human research, there's research that shows they looked at young children with hip dysplasia, and they found that the pelvis was, it had an anterior version, so it was tilted. In a dog, the front of the pelvis would be tilted down. When they did exercises on those dogs to change that angle, the hip dysplasia corrected itself. Okay, we've got a longer growing period in human children, so we've got more time. But the bottom line is that soft tissue influences skeleton. And that alone in human research should be enough for us as veterinary professionals to be going, what is the influence that we can make by strengthening soft tissue in our puppies to positively influence any one of those juvenile conditions. The third thing is, from a veterinary rehabilitation perspective, if we are seeing puppies and we are fortunate enough to see them, we really need to be communicating with our vets in terms of, this is what we want to do. Yes, we understand these are the other options. The client wants to go this way, and then a progress report. This is what we found, and an honest progress report, not a progress report that says we've made a huge difference when we haven't. And between all of us, we actually come up with a decision that's in the best interest of the dog. So those are my thoughts. How to make them listen more, I don't know. I think it's everyone that's in that loop. It's vet rehabbers, it's vets, it's vet nurses, it's puppy trainers, it's behaviorists. I mean, the list goes on.
Yeah, I mean, the puppy trainers definitely have a big part to play in this, because they're very influential in the beginning years, in those first few months, to the pet owners. The pet owners really, they're spending a lot of time with them and they're listening. In your clinic at the moment, let's take just, for example, the hip dysplasia cases. What is the average age that you would get referred? So like, how old would the dog be?
The average age, probably about 9-10 months. And that fits the bimodal curve in terms of how the dog presents clinically. So usually the pain is quite severe at about 8 or 9 months. And so, yeah, I would say is the average.
And those ones that you've maybe been referred to earlier, so the 5 or 6 month that you mentioned, have you seen that you've made a remarkable difference in those cases in comparison? I know that it's not so easy because every case is different. But in your experience, having rehabbed them, say, earlier than 9 months, is there been any changes that you've made?
I don't think I've seen enough young puppies really to comment, to really answer that question well. They are the exception as opposed to the rule. I think in general, when we see hip dysplasia dogs younger, and I'd really like someone to do a retrospective study on this, and maybe I will one day, is how many of those dogs, and it will require some financial input, but how many of those dogs can we follow through now? Some of those patients of mine are 8, 9, 10, 11 years old. I would say a good 70% of them, maybe 75, have not had surgery. They have continued. They've gone on a maintenance program. A lot of them I don't even see, but I saw them in that critical period for 6 to 12 months. Sounds like a long time, but in the length of a lifespan, now we're talking 10 years. What did we do? In my opinion, we positively influenced the muscle, the gluteals particularly. We enhanced limb awareness, so we got the dogs to actually think about engaging those legs. We really worked with the vets in terms of managing pain, so we could engage those back legs. And then once we were satisfied that we had sufficient strength and we'd reduced the instability, we taught the owners, the clients, a maintenance program. And many of them have continued with that program. So I think it would make a good study.
Yeah, I mean, I can think of a few cases, and one in particular, which was diagnosed quite early, maybe 5 or 6 months, and came to me at 6 months. And I mean, this dog was supposed to have a bilateral hip replacement and never had any surgery, and is now probably 12 or 13. And has never had surgery, is still not on anti-inflammatories, but the owner has been extremely diligent throughout the years. So we also had a very intensive time, in the beginning we were doing rehab, and she has acupuncture now once a month, and she still goes for underwater treadmill, and she does her exercises, and she's maintained. I mean, it also needs quite a lot of these kind of cases, quite a lot of owner compliance, and I think that often what happens is, for the vet, maybe they need to make a decision, are they going to refer for physio, or is it going to be easier to do an operation, because sometimes the owner might not be that compliant, and that's often what happens. It's an operation for an owner sometimes is a quicker fix, although most of them need rehab afterwards anyway, and all the compensatory issues that we have to treat.
Sure. And let's be honest, her femur head amputation is not, I've seen some that have really had not good results. So it's not always the best option.
Yeah.
In terms of surgery, and total hip replacements are pricey.
Yeah, and some of them fail. That's the other thing.
Yes.
So let's chat a little bit about the elbow dysplasia cases. So those ones, those are generally tricky for vets and for vet rehab therapists to treat. We don't often get the greatest outcomes from them. And what is your experience like in your clinic? How many cases are you seeing? When are you usually seeing them? And how are they responding?
Yeah, I usually see them in that intermittent lameness phase. And they often come to me because there is not a diagnosis. There's not a specific diagnosis. And I must be honest that most of the elbow dogs do end up having some sort of surgery. We don't seem to be as successful with the rehab, with the elbow dysplasia cases as with the hips. I think the elbows require a lot more home-based care and maintenance. The dogs are, they carry more weight on their front legs. We've got to watch the jumping. We've got to control their movements. I think it's a lot more difficult, and therefore the rehab success is perhaps less. But I think that as rehab practitioners, we need to be having these conversations with the clients, because post-surgery, there's a lot to be said for a proper rehabilitation program.
Let's chat a little bit about the medial patellar luxations. So you mentioned those too. So those ones, those cases, we often, I can remember so many times owners coming to me for an opinion. Should we do the surgery or shouldn't we? And I'm sure you've been in the exact same position. And sometimes the surgery works and sometimes it doesn't, but we're generally involved. And the other thing, if I think about, sometimes I'll see medial patellar luxation secondary to cruciate ruptures when there's been enough muscle wastage that the patella becomes mobile. And in those cases, we definitely can have an impact, right? As soon as we start rehab, that patella stabilizes. And for that reason, I always just think sort of those lower grades, I always try and rehab them because I generally do, get some improvements in them. But obviously, as the grades go up, then there's conformational issues, and it doesn't matter how much you strengthen those muscles. What is your experience in your clinic with treating these cases, and from what ages are you seeing them?
So my experience is very similar to yours. Very often they're about 8 or 9 months old when they come in. The patellar luxation has just been diagnosed. It's usually a grade 2, maybe bordering on a grade 3. And the question always is surgery or no surgery. And I think the vets struggle with that. Now, if you read the text, it's almost like there's two trains of thought. Should we do surgery and stop anything, or should we wait and see what happens and maybe do surgery later? Those cases, I think we definitely do make a big impact on the movement and the stabilization of the patella with appropriate rehab. I usually say to the client, let's work your dog for 6 weeks and then we'll reassess. I've had one dog in my time of rehabbing them, one that I can really remember where the dog got worse. And after 4 weeks, we decided to do the surgery. And after that, the dog came for rehab, and we never looked back. And it's a tricky one for me too, because what is in the best interest of the animal? So I'm dealing with one at the moment where the dog has an occasional skip, went to the vet for something else. Vet diagnosed medial patellar luxation, put the fear of, whoa, your dog's going to end up with arthritis. The dog's already 4. And now she's all in a tiz because what do I do? The dog is responding to rehab, thankfully, but she still has that little doubt. And so the question is, and this is the question I always pose to the clients, so what is feasible for you? Can you manage this dog? If you have to keep it still for 4 to 6 weeks after surgery, are you able to manage it? If the answer is no, then we should be trying to manage that luxating patella through rehab. Very, very definitely. If the answer is yes, then we proceed down another conversation about, okay, when, how, what's okay for you? Because this is my opinion, and I'd really like to see it proven, but if we can stabilize the patella, if we can strengthen particularly the quadriceps, a muscle group, then we're reducing that instability. Therefore, we should slow down the progression of the osteoarthritis. So
I agree with you. Makes sense to me.
Yeah. So I think, again, it is, like you said earlier with the hip dysplasias, it is also about owner compliance and owner availability. What are they able to put in? But he's like one of my longest standing patients. He's a little, he's almost like a Scotty cross. He's a terrier. He's full of feist. I met him when he was about 5 years old. He has a grade 3 patellar luxation on the left and a grade 4 on the right. And for various reasons, surgery was not an option. Well, that dog is now 12. He still walks every single day. He's one member of a pack of 5. He comes every week religiously for rehab, walks every day. At this stage, he is still not on anti-inflammatories. Every night, once or twice, we've had a bit of an iliopsoas, problem, because obviously it's working harder. And hey, he's great. So, but we have a particularly compliant person that he lives with.
Yeah.
So the stories are all over there.
Yeah, you see that you need that owner, don't you?
Yes.
Yeah,
And for the
that
owner that doesn't have the time and the means, then we must have a discussion about, well, we can do surgery, manage your dog for, 6 weeks minimum, maybe 12. We rehab it, and then, hey, everything should go perfectly.
Yeah, so I mean, our challenge with these cases is that we want to be seeing them earlier. And we have, the vets, which we need to educate to say, what we can do. We have the pet owners, and we obviously have the trainers. When somebody gets a puppy, I mean, maybe we should be targeting the pet owner, because in the very, very early days, maybe there are things that we can do to modify the way in which they are exercising their dogs. There's a lot of research that's been done on hip dysplasia, for example, and on the environment and how we exercise. Should we chat a little bit about that?
Sure. Let's do it.
Yeah, so I know that you know a lot about hip dysplasia because I recall you and I lecturing to vets, and hip dysplasia was your topic. So I'm going to let you fire away and chat to us about all the research there is out there on what we can do to prevent dogs getting hip dysplasia, or what we think possibly could be contributing to them within the environment and exercise-wise.
Okay, nice question. So what is part of the hip dysplasia disease complex is the genetic component. And the problem with that is we don't have one gene that we can target. So depends on the breed, they lie on different areas of different chromosomes. So the genetics has been particularly difficult to manage. But the environment plays a much, much bigger role than I think we've given credit for. We always focus, the genetics. But in actual fact, number one, nutrition. We should be feeding optimum nutrition. And there's a lot of controversy around that. And so I don't really want to get into what to feed. What I do want to say is absolutely no fat puppies. They look cute, but from a skeleton perspective and a development perspective, fat puppies for anything, regardless of whether it's elbows, hips, knees, doesn't matter. A fat puppy is a huge risk for developing a juvenile condition. Then the other big environmental factor is obviously, before we get to exercise, which we will talk about, but what is the actual environment in which the puppy lives? No slippery floors. Are there stairs? A lot of research or a lot of opinions out there on stairs. I don't believe dogs have got the neurological development to tackle stairs until they're older than 12 weeks. So we should be not allowing them on stairs until they're older than 12 weeks. And then we should teach them how to walk on stairs. Encourage hind limb awareness. Now we're starting to talk about exercise. Expose them to many different surfaces. Create little obstacle courses for them. Teach them to walk on the plank. Teach them to step over things, all in a controlled manner. So we don't want, yes, puppies will play, but we want to be exercising them also in a manner which is low impact. So I think the impact or the lack of impact is really, really important. And so that brings me, in managing the environment, have you got a large, young adult at home? Is that dog, now the adult and the puppy are going to want to play, except that the puppy doesn't have the same physical development as the young adult. The adult tempts them into all sorts of situations for which they don't have the muscle development or the neurological development. Then we get trauma. I mean, trauma is a huge contributing factor to any of these problems. What about those big dogs, T-boning the younger dogs, jumping on them? So we really should be supervising play with larger, older dogs, as opposed to allowing them to wreak havoc in our gardens. I mean, it's fun to see, but the after effects are, things like hip dysplasia and elbow dysplasia. yes, the genetics has to be there, but at the same time, what can we do to reduce the risk of it developing?
Just thinking about all of this now, I'm just thinking about the breeders, because that's another, what is your experience with breeders? Are they aware of all of this? Because really they should be, especially in the larger breed dogs, they should be educating the pet owner when they sell a puppy to a pet owner. All of this information needs to get passed over, right?
Yeah, and Megan, my experience with breeders is limited. The breeders that I do come into contact with are breeders that I would construe as ethical. And so, yes, we've had these conversations, and they get the role that they play in terms of influencing any of these diseases in the puppies that they breed. But yeah, I think that there are many breeders out there, that are not aware of it. And the question is, are they the kind of breeders that would pay attention to any sort of information or lectures? And I guess we can't make up their minds for them. We should be putting it out there. But yeah, you're right. Breeders play a huge role, because if those puppies, when they start to walk, are walking on slippery surfaces, then we're already increasing the chance of hip dysplasia, for example.
Yeah, so I think the challenge here is that we've just got so many people that we need to reach, but we need to be doing something. What is your advice? So to all the vet rehabbers out there with these cases, how do you think, how should they approach this? Is it the vets that we go to? Do we just go everywhere?
Yeah, I think so. The SAHPRA, the South African Rehab Association, is really running a campaign right now to target vets. So what is it that physical rehabilitation practitioners, what do we bring? What value do we bring to the table? So I think from a South African perspective, to leave it with an association, and I'm one of the people that will be assisting with those lectures and passing on that information. My experience is that vets listen really well to vets. So, that's a little bit of a lever that I'll be using. What I do think is, if you have an opportunity to speak at breeders' clubs, man, get out there and speak. And I know public speaking is scary. I didn't want to speak publicly for a long time, and hey, look where I am now. So, I think if you have an opportunity to be featured somewhere that reaches the public, for sure, if you're involved with a puppy school, ask local puppy schools. Ask if you can have 10 minutes on one Saturday to share a little bit of your knowledge about, just start with one topic. I think that's very achievable, because we all have relationships with those people. And yeah, I think social media has a role to play, but I also think we need to, that's a multifaceted avenue that requires more than simply putting something on Facebook.
Yeah.
And that's your area of expertise. But, I think it does have a role to play. It's just, the question is, how do you do it to be effective?
Yeah, I think what you're saying is, like, we just really got to get out there. And as a profession, us vet rehabbers, I think that we need to create awareness. And how, if it's to lecture to vets, which I know can be scary, but you don't have to lecture. You can write articles for veterinary magazines. That's not so scary to do that. You can spend a lot of time, you can research it. They usually have an editor that edits it and makes sure that the English is perfect, so you don't have to worry about that. There are different ways in which you can get your message out there. So if you're one of those type of extroverted people and you want to be out there and you want to lecture and you want to do videos for Facebook and Instagram, then you can do that. But if you're not, you can just write an article. And I say I know it's a lot of work. But vets read magazines and pet owners read magazines. So it's actually up to all of us. Every single one of us has to help to create this awareness. So it doesn't matter where you are. You can't only have an association, and if you've got an association like SAPRA we do, which is amazing, but we've called on, obviously SAPRA's called on all the vet rehabbers to help,
Yes.
so everybody has to play a part, and you can't sit back and wait for somebody else to do it. Each and every one of us actually has to start doing something, whether it's talking at a dog show or talking to breeders clubs, whatever. We have to just do our part, right?
Yep, agreed.
Tanya,
and
thank
the
you
other
so
thing,
much.
Sorry Megan, can I just tag on to that, to all the vet rehabbers listening?
Yeah.
I think one of the things that we often ask ourselves is, who's going to listen to me, and what have I got to share? But the truth is that every single one of you has your perspective to share, and the world needs your perspective. So I agree, get out there and share it in whatever way is comfortable for you, but share it because the world wants to hear it.
Awesome advice. Tanya, thank you so much for your time. It's been wonderful chatting to you, and thank you for all that you're doing in educating the vets and the public and pet owners out there about what our vet rehabbers can do.
Cool. Thanks, Megan. It's been a pleasure.
Have an awesome day. Bye-bye.
You too. Bye-bye.
Vet rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.